I mean, I'll tell you about a patient. It wasn't a terribly young patient, it was somebody in their 40s, but I saw somebody who was sent to me by a GI doc who had an abscess around the anus. And that's what they came to me for. But I started talking to the patient and we are going to drain the abscess. And I said, we're talking about their bowel movements. And I found out all of a sudden, over the past 6 months, the patients had change in bowel habits. They've had some looser stool. They've had a little bit of bleeding and even an episode of incontinence or two. So, you got to think, okay, they're here for the abscess, but something else is going on. So I drained their abscess, and something I typically don't do because it is a little painful for people who have had an infection down there. I did a digital exam on the patient because I really needed to know as soon as possible. You talk about timing. Was there something growing in there? And sure enough, it's the abscess was because of a perforated rectal cancer. And my finger, within 3 seconds knew that. And so then, we go through the workup for the patient and take care of the patient for that problem.